The real goal, it's not to live forever. The real goal is to close the gap between health span and lifespan. So if I'm going to live 80 years, I want to actually be living those full 80 years.
At a minimum, on average, a 14-year difference between lifespan and health span. So that's 20% of our lifetime. So on average, an American is going to spend 20% of their lifetime in decline.
Welcome to MD Longevity Lab, where we're playing the long game. This is a podcast where science meets real life with expert insights, practical tips, and real-world tools to not only live longer, but live better. Our aim is to radically change the way medicine is practiced and enable individuals to age gracefully, maintaining health span and vitality well into their later years. We're your hosts, Dr. Nisha and Dr. Vikas Patel, physicians, partners in life, and parents balancing work, wellness, and everything in between. Let's dive in.
Welcome back to the MD Longevity Lab podcast, where we are playing the long game. Today, we're getting right into it. We are zooming out and looking at the big picture of the state of healthcare in this country. Spoiler alert, it's kind of a mess.
Much like your day today?
Yeah, my day is always a mess. How about yours? How's your day?
My day, I think, was better than yours.
Yeah, today was like Murphy's Law. Anything that could go wrong did.
Some difficult patients.
Yeah.
Difficult husband today.
Yeah. You
dropping the ball.
Oh my God. I don't know how many of you guys have to nag your husband and then he's like, stop nagging me. But then he forgets what he's supposed to do. And then I have to pick up the pieces. This is like story of my life. It's the story of every woman's life.
I feel like I still picked up the pieces.
You did, and you apologized, which was nice. Yeah. Thanks for remembering after I reminded you.
Okay. So back to healthcare. We are spending more money than ever on healthcare, and we're unfortunately not getting healthier for it. Chronic disease is on the rise. Life expectancy in some demographics in some areas in the country is declining. And somehow we've just accepted that normal aging means being on 5 or 6 prescriptions by the time we're 60.
Yeah. And what's worse is that most of our healthcare system, it's not actually set up to keep you healthy. It's really set up to treat disease after a disease has already started. So it's reactive, and our healthcare system is not proactive when it needs to be. We are more focused on crisis care and putting out the fire rather than longevity care.
Yeah. In this episode, hopefully we're going to break down where some of the system is falling apart and what you can do to take your health into your own hands. We're going to talk about some numbers, a lot of the gaps in the current system, and this massive opportunity that we all have to change the trajectory of our own lives and really kind of the trajectory of healthcare in this nation.
For sure. Because when you look at the data, it's clear. Waiting for symptoms to start is a losing game. And the key is really prevention, health span optimization, and longevity. And that's where the magic happens.
Absolutely. And we're here to get you there with science, not really scare tactics, hopefully. The goal here is to empower you guys with good information to navigate your own healthcare successfully. The state of healthcare in the country right now, it isn't so much that our system doesn't want prevention. It's just that it's not set up to deliver it correctly.
Absolutely. So I think it would help to go over a few terms that you'll hear us use. So Vikas, why don't you tell us a little bit about health span and lifespan and what the difference is?
Sure. So I think lifespan is the term that people are much more familiar with. It's literally the length of your life. So health span is the more complicated term because it's really more focused on how long we are living functional. And that could be that, yes, I have well-controlled hypertension, but I'm completely functional. And in this country, health span and lifespan are nowhere near one another. And that's really the main problem.
So what would you say is the average lifespan in this country, and what is the average health span?
So average lifespan for men and women is a little bit different by 2 years, but it's about 78 years of age for men, about 80 for women. Health span, unfortunately, is quite a bit shorter than that. Somewhere around age 64 is when our health span ends. And so after that age of 64, up until the end of our life, we're in this state of decline where we're not doing the things that we would normally want to do, the things that when we're 35 or 40, that we would just think, oh yeah, let's go do that. I can do that. I can climb up the stairs without assistance. I can get up off the ground. I can go throw the football with my kids. I can go hiking on a trip. These are all normal activities that we wouldn't even think twice about when we're younger. But these are the things that once our health span has ended, that none of that stuff is reliably possible.
And that's crazy. That's at a minimum, on average, a 14-year difference between lifespan and health span. So that's 20% of our lifetime. So on average, an American is going to spend 20% of their lifetime in decline. That's staggering.
Yeah, I mean, I think it really gets to the point of our clinic and really to the point of this podcast, which is the real goal. It's not to live forever. The real goal is to close the gap between health span and lifespan. So if I'm going to live 80 years, I want to actually be living those full 80 years. I don't want to feel like for 10 or 12 years, I'm just in this continuous decline where I'm watching life go by and wishing I can participate.
Or by definition, you're in assisted living, you're in a nursing home, you're dependent on other people for your activities of daily living.
Correct. Yeah. Correct. Yeah. So I think this is the part of medicine today that we, in our current culture, don't do well. I think the US doesn't do end of life very well for a whole host of reasons. But giving up autonomy, giving up independence to be in some form of assisted living or full nursing care because we're just not able to do the things that we would want to do is, for most of us when we're young and healthy, I think what we want to avoid.
Yep. So we've covered some major definitions, right? Health span and lifespan. Now let's go over the 4 main chronic conditions that 95% of Americans will be affected by. So what are those 4 conditions?
Yeah, so the main ones are cardiovascular disease, neurodegenerative conditions. I'll lump together metabolic syndrome, impaired glucose tolerance, and obesity, and finally, cancers and malignancies. So those 4 major medical problems account for the vast majority of health issues outside of accidental trauma. So it's worth kind of discussing some of the numbers behind how many people are affected, how much this actually costs our nation, because those numbers are pretty remarkable.
Yeah. And a lot of times in medicine, we're worried about the zebras, the rare conditions, but it's important to note that 95% of us will be affected by one of these 4 conditions, if not more. So why don't we spend a little bit of time talking about the state of our current healthcare system and what preventative care looks like currently?
Absolutely. So how much do we actually spend on healthcare in this country and where does it go? The US spends almost 20% of its GDP on healthcare. And that is by far way more than any other country.
Well, that would be great if we were actually preventing disease. And I think that's the problem. We're spending all this money and it's not really going anywhere. Less than 5% of our healthcare spending goes towards prevention. That's literally like spending your entire budget fixing a leaky roof, but never actually patching the hole. So we're never getting to the root cause as to why these problems are happening.
The other kind of startling thing about healthcare in the US is that healthcare spending outpaces the growth of our economy. So healthcare inflation it's kind of an epidemic for us because it's not sustainable the way it is right now. Like our economy is not growing as quickly as how much we're spending on healthcare. And there's a whole bunch of reasons why, but ultimately we need to fix some of this. We end up spending about 25% of our Medicare dollars just goes into end of life care. And that's really just the last 1 year of our life. So if the average person is living almost close to 80, 25% of all the money that Medicare is spending just goes into that last year of life. And we're not necessarily improving quality of life during that period of time. We're just adding a couple months or weeks, sometimes just a couple hours of life.
Yeah. Imagine if what we could do with that 25% of Medicare dollars if that was reallocated to prevention.
Yeah, I mean, I think this is part of the problem here, right? Like, I don't think patients necessarily die with dignity in our country. Nobody really wants to die in a nursing home bed or in the hospital. And I think that's how a lot of people, unfortunately, do end up. And so if there was a little bit more on prevention, then we wouldn't be dying of quite the same things that we do right now.
So let's talk a little bit about basically the top 4 chronic conditions that we see in this country that are preventable. Let's talk about dementia.
Sure. So neurodegenerative conditions, of which dementia is probably the primary one that gets the most focus, and rightfully so. There's a bunch of different types of dementia, but the one that's most prevalent that most people hear about is Alzheimer's. About 6.7 million Americans have Alzheimer's, and that's right now. It's projected to be double that, about 13 million by the year 2050. And the cost of dementia care in the US is right now, it's around almost $350 billion annually. And so by the time that we've doubled the number of people that have dementia, that number is supposed to surpass $1 trillion by 2050. The real kicker with all this is that we can actually do something about that and reduce risk by more than 40% for people so that they don't develop Alzheimer's. And if they are going to develop it, that they're pushing it later and later into life so that they're not feeling the decline. And those things that change that is these preventative kind of lifestyle factors like exercise, diet, sleep, making sure that you actually know what your blood pressure is and we're doing something to mitigate it. So that's one of the big preventable diseases I think that we focus on. Another one is a cardiovascular disease.
So dementia goes in that bucket of chronic diseases that we talked about. So dementia, cardiovascular disease, obesity and metabolic health, and cancer. We talked about dementia. Let's go through cardiovascular disease. That is the number 1 cause of death globally. And 1 in 3 deaths in the US is heart-related. 80% of heart disease is completely preventable through lifestyle changes. 80%. There was a study in the early 90s, and they examined autopsy results of patients aged 15 to 34. These are young patients that died of
It's mostly trauma related.
Trauma, motor vehicle accidents, homicides, suicides, and they found early atherosclerosis, meaning early cardiovascular disease, in some patients in their late teens. And they found aortic plaques and coronary plaques that had already formed and hardened in patients in their 20s. So cardiovascular disease is something that is brewing early. It starts in our pediatric years, and we're even seeing evidence of it in these teen years. So, and that study was done 30 years ago. I can't imagine with the state of health and how it's going now that those numbers haven't worsened.
Yeah. So cardiovascular disease, considering 1 out of 3 people are going to succumb to cardiovascular disease globally, the fact that we can put in intervention pretty early to prevent it and delay the onset by decades, it's something that we definitely have to pay attention to.
Yeah. So we hear from patients in their 30s, like, I'll worry about it later when it affects me. And it's kind of crazy because your heart is keeping score.
So the next one is probably obesity and diabetes. So this is another huge one, and particularly a big problem in the US. 42% of US adults right now are considered obese. And that number is supposed to hit 50% just by the end of this decade. And this is almost a ridiculous statistic, only 12% of Americans are considered metabolically healthy. And, what does that mean? Metabolically healthy means that that you don't have any sign of impaired glucose tolerance, which is what leads to diabetes. So only 12% of Americans fall into that quote unquote healthy, metabolically healthy category. So how much does obesity and metabolic disease cost us? It's costing us right now somewhere in the neighborhood of around $175 billion per year. And again, and that's also projected to increase exponentially as our population kind of gains more weight over time. We're kind of literally eating ourselves into bankruptcy. And
No, a big culprit is the food industry. And I think that's a big topic of conversation now.
yeah, I mean, I think it's worth mentioning. And it's hard to, it's not like I don't believe in capitalism, but it's hard to just blanket statement blame the food industry because they want to make profits and they do science to figure out what people want to eat. The problem is that we're not informed enough on what it is they're doing to our food to make good choices and say, well, I can only eat this as a treat once a week or once every couple of weeks. I can't make this a staple of my diet. And so we can get into a little bit about how nutrition works and how the food industry kind of manipulates us by how they actually prepare food.
So, and the fourth chronic condition would be cancer. And obviously, this is a cause that's near and dear to my heart.
So I'm sure you guys have heard that there's kind of been somewhat of an epidemic in cancer diagnoses in the last 10 to 15 years. And one of those kind of surprising statistics is just the rate in colorectal cancer. That has literally doubled just in the last 25 years in adults under the age of 50. And it's one of the reasons why in the last decade, the cancer screening guidelines went to a younger age for screening colonoscopies. There's also quite a bit of evidence now that says that breast cancer, pancreatic cancer, endometrial cancers, they're also on the rise for younger populations. And one of the things that I think sometimes gets left out of the conversation is the lifestyle factors that lead to cancer development. So as Nisha had mentioned earlier about herself, her type of cancer is a genetic type of cancer, and it's not really, its prevalence doesn't have anything to do with lifestyle factors. But the types of cancers that we're talking about are really kind of environmentally derived. And so these rates increase with obesity, with poor diet, and even environmental factors such as microplastics and food dyes and things that do sometimes make it into the mainstream press.
But for patients that, let's say, already have a cancer diagnosis, I think it's so important to really hone in on those lifestyle modifications to make sure that you have the best chance of good health going forward.
Absolutely.
So what are the takeaways? I think we're spending way more on treating disease than actually preventing it. I think that's a key point here. Chronic diseases like dementia, heart disease, obesity, embolic dysfunction, and cancer are largely preventable. And our goal is really to help you make small, sustainable changes so that you're really thriving long term.
Yeah. None of us wants to be 85 and in a diaper or having our children take care of us at that age or being in assisted living. And I think that if patients are coached a little bit better on what are some things that I can do now, then a lot of those end of life issues can be prevented.
For sure.
I think to kind of wrap this segment up, we're focused on the things that your doctor can't focus on because of the way medicine is delivered today. There's no doctor that, that's going to tell you, eat whatever you want, be a couch potato and smoke and drink, like they're all going to kind of generally say the right things. But the problem is that our training isn't really geared towards these are the best ways to coach patients. These are the best ways to identify early what specifically this patient is at risk for or that patient is at risk for. And then to spend the time coaching that patient on, well, let me look at your life. What are the changes that would actually make sense? Like, sure, you need to lose 20 pounds of weight. Well, you need to lose 20 pounds of fat but you need to retain the muscle mass. And oh, by the way, your bone density is a little bit low. So we need to do a few things to make sure that you're not losing any muscle mass and that you're actually gaining bone density at the same time that you're losing this weight. So it's a nuanced conversation, and there's just no time in a 15-minute primary care visit to be able to deliver that kind of information effectively.
You spend 3 hours with your patients. What insurance company reimburses for that? There's none. And those conversations are so valuable. Insurance companies are kind of incentivized to see patients every 10 minutes, do procedures, write for this pill. So we're really not incentivized to practice medicine in the way that it was intended. And so a big movement now from patients, from physicians to push back on these insurance companies and really demand better healthcare. I think for now, many of these things are not covered. In the next 10 years, I'm hopeful that they will be. For now, I would say most of these things are patient driven.
I think a lot of stuff that we'll be discussing are things that absolutely should be available to the general public and kind of covered in basic preventative services, because these are the things that would reduce healthcare dollars. Like, you spend a little bit up front to get a huge bang for your buck in delaying chronic disease, delaying death, making sure that people are living healthier for a much longer period of their life, where they're not having to take from the system, from the healthcare system, essentially. And so we want to be able to coach you guys on the things that your doctors probably just don't have as much time to deliver. We're all kind of indoctrinated into a system when we go to medical school and then start seeing patients in the hospital setting and primary care setting. And we're almost too young to question, is this like the best way to do it? Because we're focused at that time really on, okay, here's a disease and here's the first line treatment, the second, the third, the fourth. We're not really focused on, well, what would we do to prevent this person from getting the disease in the first place? Our medical education just isn't geared that way. And it's not a knock necessarily on medical education. It's just that the system hasn't caught up with what the actual problems are in our culture. And I think there's going to need to be a readjustment over the next 10, 15 years so that we're delivering better care in that regard.
Absolutely. Because I don't think any of us wants to be 85 in a diaper wishing we'd eaten a little bit better or moved a little bit more in our 40s. So we have the power to make the change now. Your health is in your hands. And really, I think it's small, consistent changes that can have a massive impact.
So stick around. We'll break down what actually works, why it matters, and how to do it without feeling like this is your full-time job.
Yeah. So I think we've learned that the system is flawed, but that doesn't mean we're powerless. In fact, it's the opposite. So the more we understand about how the system works, how insurance works, and where it doesn't work, the more we can make informed decisions about our health and the health of our loved ones.
Our goal here isn't to bash doctors or medicine. We're doctors. But we've seen firsthand how people fall through the cracks when all we do is treat symptoms. And we don't want that to be your story.
For sure. So longevity isn't about chasing perfection or biohacking every minute of your day. It's about building a stronger foundation, right? And making smarter choices and stacking the odds in your favor, starting now. The earlier, the better.
Yeah, because no one else is going to prioritize your health the way that you can. Not your insurance company, certainly not the healthcare system, and truly not even your doctor if they only have 10 or 15 minutes to spend with you.
For sure. So consider this your wake-up call, but the kind of wake-up call that comes with coffee and good company. So we are just getting started. In the next few episodes, we're going to be diving into the core pillars of Healthspan and the things that you can control. And we're going to give you all the tools that you actually need to do it. Vikas, what are some of the topics we're going to be covering on this podcast?
Yeah, great question. We're diving into all the big things that impact longevity and health span. We're going to try and cover exercise, nutrition, sleep, hormone health, gut health, supplements, which is a big one, and mental health, among a lot of other topics. We're also going to try and talk about all of the diagnostic and laboratory testing. And when lifestyle changes just aren't enough, we'll also explore the smart and evidence-based use of medications. Thank you for listening today. Let's keep playing the long game together.
Thank you for playing the long game with MD Longevity Lab. You can visit us at www.mdlongevitylab.com to learn more about how we can support you on your journey. Stay connected with us on social media at MD Longevity Lab for tips, updates, and behind-the-scenes insights. If you enjoyed today's episode, we'd love it if you subscribed, left us a rating, or shared it with someone you know who's also playing the long game. Thanks for listening. We'll see you next time.